Thank you for joining us for the NeHC University program today, covering an overview of the recently released Governance Request for Information. This is Kate Berry, CEO of National eHealth Collaborative, or NeHC. NeHC is a public-private partnership with a mission to advance nationwide health information exchange to improve health and health care. NeHC focuses on three major areas. We convene the Consumer Consortium on eHealth. We do a great deal of work on health information exchange. And we provide web-based education programs on health IT under the brand of NeHC University. Today we are very pleased to welcome Stephen Posnack from ONC to cover the Governance Request for Information, and I'll introduce him in just a moment. Next slide, please. We offer a wide variety of education programs, including Spotlight Learning Series on health information exchange, consumer engagement, and the Beacon communities, careers in health IT, ONC initiatives, and trends in health IT innovation. Next slide, please. We have a couple of great programs coming up next week. On Wednesday, May 23rd, we'll offer another program in our Spotlight Learning Series on consumer engagement and health IT. And that program is entitled The Community as a Learning System for Health, Using Local Data to Improve Local Health. The program will summarize a report of the National Committee on Vital Health Statistics. The report is the product of a year-long NCVHS Community Health Information Project, which examined how communities can become learning systems and what resources exist and are needed to help them. To discuss the findings of this report and subsequent work for this program, we'll have Dr. Larry Green from the University of Colorado in Denver, Dr. Justine Carr, who chairs NCVHS, and Linda Kloss with Strategic Advisors. Next slide, please. On May 24th, NeHC University will offer its next program on the Beacon Communities series, and this program will feature in-depth case studies of the Beacon communities in San Diego and Utah. Next slide, please. You can download Stephen's slides here at the URL on the screen, and next slide. Hopefully by now, many of you have had the opportunity to review the RFI that was published in the Federal Register just a couple of days ago. And by now you may have lots of questions, so hopefully we'll have plenty of time for Q&A. During the program, please do submit your questions as they come to mind and enter them into the Q&A window at the bottom right-hand side of your screen. And now I'm very happy to introduce Stephen Posnack. Stephen is the Director of the Federal Policy Division within ONC's Office of Policy and Planning. He joined ONC in 2005, and he served as Project Officer of the Health Information Security and Privacy Collaboration. He also was the lead staff for the American Health Information Community Confidentiality, Privacy, and Security Workgroup. And Stephen is now responsible for ONC's legislative and regulatory affairs. In this capacity, he leads ONC's review of legislation and regulations from across the executive branch and briefs ONC leadership on legislative and regulatory issues that may affect ONC. Following HITECH, Stephen's responsibilities were expanded to oversee ONC regulation development efforts. So without further ado, I'm going to turn the program over to Stephen.
All right, thanks, Kate. Thank you, everyone, for joining today. I guess for some of you, it may be an encore performance. For others, it will be your first time with me. So I'm going to go through the recently released request for information. This is a real important time in health policy overall, and even more so in health IT policy. And this activity reflects, I think, a real critical component of our agenda. So I'm here to walk you through the brand new RFI titled, as this title slide represents, Nationwide Health Information Network Conditions for Trusted Exchange. The RFI is jam-packed with information, so before we jump into the details, I just wanted to ground folks with a few overarching points. I'm going to go through the background, how we got to where we are today in a very quick flyby, but overall emphasis, I think, is just that we're at a point where we feel we're ready to have a discussion about governance. It's time for discussing governance for nationwide health information exchange, and ONC in its role and its charge through the HITECH Act is ready to lead that conversation. So how did we get from where we were to where we are today? And as I've had a unique kind of point of view, being at ONC since 2005. So writing the background for this was a little bit like a memoir in terms of activities that I've been engaged in. And starting in the beginning, we had an initial prototype and trial implementation phase where ONC let out contracts. For those of you that remember the first contracts that we put out, 2005, 2006, to get folks thinking about what nationwide health information electronic exchange would look like. And there was an RFI that went out preceding that, as well as subsequent work to work on prototypes, trial implementation, the Nationwide Health Information Network Exchange initiative that exists today went further to go through limited production pilots. Now some of them are in production with various federal agencies and private sector organizations across the spectrum. We also have engaged in other activities related to advancing electronic health information exchange, most recent being the DIRECT project, and have had solicited feedback over the course of time that led us to this point from our advisory committees. And probably the most direct recommendations that we have received have come from the policy committee, whose governance work group really thought through the seeds of what has now sprouted into this RFI, and we've done our best to reflect their guidance as well as the other recommendations from the HAT Policy Committee and HAT Standards Committee from their various work groups in different capacities, whether it be privacy and security, information exchange, or just standards in general. So why did we publish an RFI and not a notice of proposed rulemaking? As you may have heard or had heard our intention many moons ago, I'd like to emphasize, we are at a real important point here. It's really the beginning point for us in a policy formulation process, and it's with that little dose of humility that I'd like everyone to keep in mind. We recognize that governance and establishing a governance mechanism for the Nationwide Health Information Network is going to be bigger than just ONC, and is going to require a lot of engagement, partnership, conversations, dialogue about how we can make the most productive use of our statutory authority. So we need everyone's feedback. We need everyone's expertise. We know we don't know all the answers, and that's why we need you to do your part in commenting on this request for information to really help us through the policy formulation that is ongoing. So that's why I'm here today. This RFI is ONC saying, now it's your turn to contribute. Consider what we're missing, what we can make better, and whether we'll get the outcomes that we're seeking to achieve. And process-wise, this is an open period where we're seeking your expertise. We'll take that feedback and use it to inform the notice of proposed rulemaking processes that we're working on in parallel, so to speak, to keep pace. Next slide, please. And just as a friendly mention, I'm going to try to say everything consistent that I said the last time. I try not to contradict myself. It's a lesson in consistency for me to do these more than once. And I will try, for those of you that were on the phone the last time around, and presumably now folks have had almost a week to read this puppy, to leave some additional time left over for questions to the extent that I'm capable of answering them. So for those of you that have caught presentations from me before, and as you know, kind of my role and responsibility here at ONC, I like to start with our statutory authority and what we're using to implement the preeminent authority that we have stemming from the HITECH Act, which amends the Public Health Service Act, which is PHSA, the acronym there, requires the national coordinator to, quote-unquote, establish a governance mechanism for the Nationwide Health Information Network. So that's the starting point from which we're working. And I note here that the statute didn't say the national coordinator shall govern the Nationwide Health Information Network. Rather, it charges us to establish a mechanism for governance. And as the RFI explains in greater detail, we have approached implementing the statutory language by asking, where can ONC uniquely add value? And in answering this question, we framed a multifaceted approach in terms of what we think an effective governance mechanism should include. Another general point that I'd like you to keep in mind is that through the governance mechanism we would establish, we're looking to create the foundational structures and processes that would be necessary to support nationwide electronic health information exchange over the long term. At its core, the governance mechanism you see discussed in the RFI is not necessarily about one particular form or method of electronic exchange. Rather, it's about putting in place the building blocks, policy and technical building blocks the nation needs to make all forms of electronic health information exchange take place. Next slide, please. So what is the Nationwide Health Information Network? And for those of you that are familiar with have been to ONC's website in the past time, this understanding, this concept of the Nationwide Health Information Network has evolved. And for the past few years, ONC has described the Nationwide Health Information Network as a set of standards, services, and policies that enable secure health information exchange over the internet. So to clear the air, a few things that it's not. It's not a single national database. It's not a network of networks, which was a conceptual description that was evolving in the early course of its livelihood. And it is not a single body or a specific group of entities that would constitute the Nationwide Health Information Network. It's, again, a set of standard services and policies. And like the internet, when the right set of standards, services, and policies are put in place, we believe great things can happen. And that's really our vision for this governance mechanism that we hope to establish, to create a, for lack of a better word in my terms here, a big bang moment for health information exchange. Next slide. Why act now to establish a governance mechanism? As I mentioned, we're at the beginning. And among many other reasons than those listed here, we believe the time is now to act to establish a governance mechanism for the Nationwide Health Information Network. Electronic health information exchange addresses critical needs in our healthcare system. It can do many other things than those, the two that I've listed here about improving care coordination and quality improvement. This second bullet is really important. Part of what we hope to achieve with our proposed governance mechanism is to shift the trust paradigm that exists today, which kind of frame and other folks have used in various settings, trust on a first-name basis. Today, providers who electronically exchange typically know each other. Through the establishment of a governance mechanism, we hope to reach a point where that need not be the case, where trusted exchange can occur beyond those providers with whom you're on a first-name basis to any provider at any time from which a patient may seek care. So part of this at RFI is to frame and to lay the groundwork for a mechanism that can help making this shift, make this shift possible. With respect to my third bullet here, this really, I think, sums it up. Electronic health information exchange, from our point of view, has enormous potential. But in order to unlock that potential, we need some baseline rules of the road. And that is what this governance mechanism is all about. Finally, this last bullet reflects a fact of life that, in our estimation, in the absence of any action on our part to establish a governance mechanism, stakeholders in the community will have unmet needs from both a policy and technical perspective. And as I mentioned before, we see ONC providing a unique value to the industry here from a central kind of coordinating, facilitating partnerships, relationship building standpoint. And we hope that this governance mechanism will be able to address the needs of stakeholders broadly as it evolves. Next slide. So we view the establishment of a governance mechanism as a unique opportunity to create new markets and opportunities for innovation. For this second bullet, again, governance for us is about establishing an infrastructure that can support the steps that states and other stakeholders seek to implement while setting forth some consistent minimum rules of the road that let stakeholders focus on what matters, delivering high-quality care. I'd note for this third bullet about laying a foundation necessary to support future stages of meaningful use. We've all heard about the escalator and increasing exchange and interoperability and making that an important component of meaningful use over the course of the program. And there is language in the CMS NPRM specifically related to the transitions of care objective, where there's a brief mention of the governance process and how we would initially hope to link these two together to form a better synergy. Finally, to use the governance mechanism in a way that can galvanize stakeholders and focus priorities towards an ever-maturing electronic health information exchange market. That's really what this fourth bullet represents in terms of an objective that we hope to achieve with governance. Next slide, please. So for those of you that have made it through, congratulations. I've heard it being referred to as being a little bit dense. We've tried to make it as fun a read as possible. I know that it is probably longer than other RFIs, but definitely shorter than many of the regulations that the department puts out. So kind of in an in-between spot. Our goal is to make it, and part of my personal mission for 2012 is to make regulations fun. So since this is kind of a precursor to our regulatory process, we did want to make this as educational and as informative to read as possible while fleshing out the concepts that we hope you can comment on and provide us some insights on. Just wanted to use this slide as a way to kind of ground you in the RFI itself without, if you haven't had a chance to read through the whole thing. This is what it covers, really the kind of Cliff Notes version. So the first anchor point here is that the RFI and the policies included therein primarily focus attention on the entities who facilitate electronic health information exchange. As the RFI states, we're not considering proposing some type of mandatory governance paradigm. Rather, we would like to construct a governance mechanism in such a way that its value to all stakeholders in the market is what drives compliance with the conditions for trusted exchange that we'd establish. So this third bullet here kind of breaks down the RFI into 5 areas in which we see comment. The first being that we would establish a set of conditions for trusted exchange. These, for those of you that are catching on to our new terminology, we refer to them and abbreviate them as CTEs, so conditions for trusted exchange. I'll start using the CTE abbreviation as I go through talking here. A subsequent validation process for entities to demonstrate conformance to the CTEs, and then additional processes that are part of this overall governance mechanism that we seek to establish. That one pathway would focus on the CTE process, the maturity life cycle for CTEs. Another would focus on the process to classify the readiness of technical standards and implementation specifications to support interoperability-related CTEs, and generally provide a roadmap for standards implementation specifications for the nation. So one final point that I would mention here, as I've mentioned before, the governance mechanism we've laid out is multifaceted in order to meet the diverse needs of stakeholders out there. One of its facets, the adoption of CTEs and the NVE validation process, would essentially establish the formal existence of trusted third parties that have met federal standards, and these would be the conditions for trusted exchange. This facet anticipates that many healthcare providers will rely on a trusted third party to facilitate electronic health information exchange on their behalf, be it push methods, pull methods, or both, or some other method of electronic health information exchange. Any time that a trusted third party would be engaged, these would be the entities that would be facilitating electronic health information exchange. We would seek through the governance mechanism to establish some common baseline requirements for those trusted third parties. However, in cases where a healthcare provider is interested in pursuing electronic health information exchange methods without a trusted third party, just kind of direct point-to-point, the other facet of our governance mechanism, specifically the standards and implementation specification classification process, would enable them to engage in electronic health information exchange using nationally accepted standards. So that road mapping, the identification and classification of standards that are essentially nationally ready, those are other ways for parties that are interested in engaging in electronic health information exchange fit underneath this governance mechanism in the event that they're not using a trusted third party, which is what the CTEs would apply to. Next slide, please. So these are the conditions for trusted exchange in the three categories that we've established. We have safeguards, CTEs. These focus on the protection of individually identifiable health information. We have interoperability CTEs. These focus on technical standards and implementation specifications needed for exchanging electronic health information. And then we have business practice CTEs that focus on operational and financial practices to which NVEs would need to adhere. And just as a quick programming note, I've used the NVE acronym a few times. That stands for Nationwide Health Information Network Validated Entity. And so if an entity went through the validation process, demonstrated its conformance to conditions for trusted exchange, they would be designated in some form an NVE, and that would be a way in which they could separate themselves in the market and identify. So next slide, please. So I've got a few slides here that list the actual conditions for trusted exchange language. I would caution you not to take these out of context. Each of these has, if not several paragraphs, a couple of pages dedicated to them, and our thinking behind them in the RFI. But I will touch on, as an example, the first one here, which is another programming note, as an abbreviation and shorthand for people to readily identify the different conditions for trusted exchange and list them in a number format so we can keep track of them as well. We use this schema of the first letter or two of the CTE category and then the number of the CTE. So S1 would refer to safeguard CTEs and the first CTE that we've listed. This one specifies and is really another concept that we've included in the RFI and that we would seek to include going forward would be to leverage, where possible, existing regulatory frameworks and policies that exist today and apply them to the electronic health information exchange environment where there are gaps, which is where some of these CTEs try to comment on. That would be where we see the governance mechanism providing some additional value. And in some cases where existing regulations and policies don't necessarily touch on some of the unique aspects of electronic health information exchange, that's another area where we see where trusted third parties are involved, that there needs to be some consistency. So safeguard number one here really boils down to a consistent implementation of security practices. We've leveraged the HIPAA security rule, and for those of you that are familiar with how all of those things have evolved, the security was published February 2003, 2009. With the HITECH Act, Congress specified that the sections that are listed in the 300s in Part 164 would apply to business associates of covered entities in the same manner as they apply to covered entities. Accordingly, and because we believe that nearly all NVEs will be business associates of covered entities or covered entities themselves, we believe that mirroring the statutory requirement is the best starting point for NVE's overall security practices. And one of our main goals in establishing a consistent trust baseline for electronic exchange. Now, the one difference here that we've called out that we believe is relevant to ensuring additional consistency, because we're talking about a similar function that certain group of entities would perform, this CTE specifies that the addressable implementation specifications in the HIPAA security rule wouldn't be addressable for these types of entities. They instead would be required. So that just gives folks a little bit of flavor again, there's way more of a discussion about that requirement, that condition for trusted exchange, as well as many of the others that are listed here. Next, please. So there are 10 safeguard CTEs that we've included in the RFI. There are 3 interoperability CTEs that I'll get to in the next slide, and then there are 3 business practices CTEs that will follow after that. These are by no means an exhaustive or comprehensive list of the conditions for trusted exchange that we're considering. And I will make a plug here and probably in another slide that in any case where you all out there that are reading the RFI and considering or commenting, if there are additional conditions for trusted exchange that you think we should consider right away and up front, please do let us know. I would make a personal plea to see if you can try and frame them in the same manner that we frame them, and provide any additional context and rationale as to why you think those are important. I would note, in a lot of cases, we've tried to accommodate the different electronic health information exchange modalities that could be represented, and we also recognize that some of the more comprehensive and complicated electronic health information exchange methods still have ongoing policy discussions associated with them, whether it be in our advisory committees or just in the industry at large. And what we're trying to do, keeping in mind that we have to go through a regulatory process, is not to get ahead of those discussions in instituting into our regulatory process things that still require industry consensus and some maturity. Next slide, please. So along those lines, we've represented a set of 3 interoperability conditions for trusted exchange that we're seeking some initial feedback on. But again, my public service announcement to you, that's not to say that we are at all limited to these conditions for trusted exchange. If there are others that we should consider, please do submit that in your public comments, and also explain, how that would help accelerate electronic health information exchange from a kind of consistent common baseline, keeping in mind this rules of the road concept that we're trying to pursue. Next slide, please. So we have 3 business practices, conditions for trusted exchange. These are, again, these CTEs focus on the operational and financial practices to which NVEs, which would be these trusted third parties, would need to adhere in order to support, in support of trusted electronic health information exchange. These are really about the NVEs being trusted not only by the healthcare providers for whom they facilitate electronic health information exchange, but also other NVEs that they may engage with, essentially being stand-up health information exchange citizenry. So we've crafted these CTEs to address some of the concerns we've heard over time, and we look forward to your input on them and whether or not they sufficiently address the concerns that have been raised in the industry that we've heard of, and what other business practice-oriented CTEs that you think from a consistency perspective across all of these potential nationwide health information network validated entities that they would need to agree to. Next slide, please. So I touched briefly on the NVE concept and becoming an NVE, and this RFI sets forth an initial set of preconditions that which we call eligibility criteria that we think would apply to the entities seeking to become a nationwide health information network validated entity. If these preconditions are met, and there's a number of them that are specified in the RFI, the entity would continue on the process towards seeking validation. We anticipate that the different types of trusted third parties that would be eligible entities to become an NVE would include, but not be limited to, all of these types of entities that would facilitate electronic health information exchange on behalf of providers. Again, it's not an exhaustive or comprehensive list, but just wanted to give folks a sense of the different types of players that we want this governance mechanism to be able to accommodate. Next slide, please. So as I mentioned, we have the conditions for trusted exchange. We would then subsequently have a validation process, and validation is an umbrella term that we've been using since the governance work group of the policy committee first kind of came up with it in a manner to represent different methods to assess conformance with the conditions for trusted exchange. We expect or anticipate that in some cases, conditions for trusted exchange that focus on more technical aspects could be, I'll use validated, but could be confirmed or assessed or evaluated through technical testing and certification means, as opposed to some of the other conditions for trusted exchange, which some of the safeguard ones may lend themselves to more of an organizational assessment, whether it be through accreditation or some other type of assessment of the organization's policies and practices. So more people and process versus technology. So the validation process in terms of its structures and the actors involved, we think that the model that we have established for our permanent certification program lends itself to replication. The industry is familiar with this type of process now. So ONC would select an accreditation body that would then assess the competency of different validation bodies. And then those presumably multiple validation bodies would then be accessible and available to validate different entities' compliance with the conditions for trusted exchange and go forward. So if an entity becomes successfully completes the validation process, then they would get this designation or recognition as an NVE. Next slide, please. So as I mentioned, one of the facets of the governance mechanism beyond the CTEs and the validation process is a process to update and retire and kind of maintain the CTEs over time as well as mature them. And so we've come up with this classification scheme that we include here and in the next process that I'll discuss about bucketing the CTEs as they mature into emerging, pilot, and national classification. Next slide, please. So one of the things that we've heard from an industry perspective, as I mentioned, in terms of road mapping, where standards and implementation specifications are over time, how adoptable they are, how mature they are, what additional aspects would need to be considered. We think that the governance mechanism could include a process to annually review the technical standards and implementation specifications to help inform the maturity pathway, to have a publicly available roadmap for folks in terms of the direction that the industry is going in, what standards are coming out, and when they may be ready for national use. And so we also think that this process can help identify gaps and then spur activities, whether it be through the standards and interoperability framework or other SEO activities that could be called to help fill the need. So I think that's pretty much everything that I wanted to say here. Again, same classification status. Thank you for advancing the slide. Finally, the last thing that we've discussed in the RFI is how we see monitoring and oversight being part of the governance mechanism. This ranges from processes to receive and address complaints to processes for ONC or others to revoke an NVE status in the event of some type of untoward activity occurring. But this is something that we really see as a shared responsibility among all the parties that would be part of the governance mechanism, as well as those that are just engaged in participating in electronic health information exchange and using NVEs. So the actors involved in this include ONC, the different bodies that we would have as part of the validation process, the accreditation body and validation bodies, as well as other federal agencies. And so this isn't just going to be one circle where there would be some regulatory paradigm. There are a number of circles that overlap with this governance mechanism from a kind of regulatory oversight. Some agencies that we think could play a role would be the Federal Trade Commission, the Office of Civil Rights, because obviously this involves health information. So working out how all of us work together from a monitoring and oversight perspective is something that we think would be a part of the governance mechanism. Next slide, please. That pretty much wraps it up. Leaving a decent amount of time for some questions. I will do my best to answer them, but please recognize, as I stated in the beginning, I'm here to get the word out, to run you through the RFI in the best way possible from a voiceover, and really interested in your feedback and comments on the request for information. It is published now in the Federal Register. I believe we've got the comment bucket set up on regulations.gov, and comments will need to be in the middle of June. So that wraps it up for me.
Thank you, Stephen. That was fantastic. We do have lots of questions, so I'll just jump right in. First of all, this is from someone who's reviewed it several times. So one thing that I haven't been able to ferret out from reading the RFI several times is where the boundaries of the governance mechanism proposed here are. How would I know, for example, as an EHR vendor, if I need to become an NVE? Are there identifiable triggers that we can tell the industry about that would indicate the need for voluntary validation?
Well, so that's a great question. And, you know, as I mentioned earlier, we are really looking at the value proposition for the governance mechanism and how it can add value to the market. And the NVE designation is also, as I mentioned, is something that would be elective. It would be voluntary. And so we hope that in establishing a consistent set of conditions for trusted exchange that would help jumpstart trust-building relationships, that there would be value in different entities across the spectrum in seeking NVE status. And so there wouldn't necessarily be a kind of regulatory trigger that would throw someone into the pathway of becoming an NVE or necessitate that they become an NVE. What we hope is that this designation would allow for, on a trust basis, folks to that are facilitating electronic health information exchange to get this designation and to be able to represent to the parties that they would exchange information or for which they would exchange information that they've met certain baseline standards.
So another one, thank you, Stephen. Does ONC see the HIE governance more as an analogy to the CMS Medicare condition of participation rules?
That's a great question too. You know, we've looked at them. There is a bit of a different paradigm involved in the conditions of participation on the CMS side. You know, there's a lot of things that those are tied to that this mechanism wouldn't necessarily mirror. We've looked at them, I mean, from I'll speak from my point of view as a kind of regulation developer, what we could learn from the specificity that are in the conditions of participation and the subsequent guidance that CMS provides associated with them, and trying to balance what absolutely needs to be in regulation and what can evolve in a little bit more of a rapid and flexible standpoint from a guidance perspective. That's really, from a regulatory analysis perspective, what we've looked at, or what I've looked at in terms of the conditions of participation.
This one, I'm not sure if it's just elaborate on the acronym or elaborate on the concept, but the comment is, please explain NVE.
Okay, sure. So I can elaborate on the acronym first. NVE stands for Nationwide Health Information Network Validated Entity. So we took the N from Nationwide Health Information Network and then the V and the E from Validated Entity. That's just a shorthand way of referring to the entities that would facilitate electronic health information exchange that have been through the CTE validation process, come out the other end with a thumbs up, and they would be able to, and this is one of the things that I think we ask for comment on, how they should be able to represent themselves is this some type of seal or certificate that we assign to them, a stamp of approval, list them on ONC's website, something to make it publicly known and available that these trusted third parties that would be facilitating electronic health information exchange had met the different conditions for trusted exchange.
Very good. So, Stephen, from ONC's perspective, what is the benefit of interoperable HIEs to competing healthcare organizations? The benefit to the patient and government is more clear. What kind of feedback have you received from healthcare organizations? Does ONC perceive readiness and enthusiasm?
That's another great question. I think that we would be interested in any insights that folks have in responding to the RFI about how it will help different healthcare organizations meet their missions and goals, as well as our goals and objectives for electronic health information exchange. I think everyone agrees with the benefits of electronic health information exchange and how its potential to improve healthcare quality, care coordination, and make information available that to providers that need it when it's necessary. And there are, as I think the questioner raises, a lot of just environmental questions that still need to be discussed. And that's where we get to some of the business practice CTEs and other interoperability CTEs that the governance mechanism could help address the different needs of stakeholders.
Great, Stephen. Is the core idea that HIOs would use the CTEs to become NVEs? Does that mean we are moving from the push model or direct to a pull HIE model as the national paradigm?
So we want the governance mechanism to be able to support any type of electronic exchange paradigm, and that's really why, if I go back to the start of the description of the Nationwide Health Information Network, it's this collection, the set of standard services and policies, of which both specifications for directed exchange, point-to-point exchange, and more comprehensive query, push, pull models could all coexist together as part of the governance mechanism and as part and embodied in different conditions for trusted exchange. One of the things that I left off my prepared remarks here that I'd note that we include in the RFI as a comment that I would encourage folks to think critically about has to do with right now the CTEs are just a list, and we could envision packaging the conditions for trusted exchange into more logical packages, bundles that would help support different exchange modalities. Some of the things that could be in a query-oriented or pull-oriented conditions for trusted exchange may not be relevant in a push, especially in some of the safeguards CTEs that I could think of. And so where that divergence could occur, that's where we could see some different bundles being packaged together. And presumably, I'm kind of throwing up my hands here on the phone, as we could come up with different designations as well that could make it known to the different stakeholders out there, the different types of CTEs that folks had, that these NVEs had been validated against, and the different services that they could provide in conformance with the conditions for trusted exchange. So again, it would be, as we've stated, a voluntary process. So if there are health information exchange organizations out there, we'll go back to RIOs or whatever they've chosen to call themselves right now. We would hope that the value in meeting the conditions for trusted exchange would help establish a baseline of trust and interoperability conformance, so that it would really jumpstart any additional, if necessary, negotiations that would need to take place between exchange parties.
With regard to safeguard number 4, are you saying that the payload must be encrypted or that the payload must be exchanged over an encrypted channel?
So that is one where I'd point you to the RFI, but the quick answer is both. And I say both in the terms of in the discussion that we include for the CTEs, we ask about the different ways in which they could be satisfied. So in this case, it could be that the entity facilitating electronic health information exchange could facilitate encrypted data, or they could be the ones performing the encryption, or they could be the ones that create the secure pipelines in which the information could be exchanged. So that's an area where we solicit comment on what would be the best way to accommodate different implementations.
Does ONC anticipate that every local or regional health information exchange connecting to the Nationwide Health Information Network Exchange or to an ONC-funded state HIE be credentialed as an NVE?
I mean, I think that is, we mentioned in the RFI that we could see the potential to leverage this NVE designation to meet different exchange and policy objectives that we would have in the future. I don't think that anything is on or off the table in terms of a specific direction that we would seek to go in right now. If folks think that would be a valuable approach for us to take, I would encourage you to, make that comment. But I think I'll probably stop there.
With regard to safeguard number 10, who is the provider? What about case managers who need to have information in real time for care purposes?
So that would be an excellent nuance to raise, and I can't do justice to the dialogue and presentation of this CTE over the phone, because that one is one of the more detailed discussions that we have in the RFI. And so that's a great point, and something that I think we need to consider in terms of whether or not a modification for more of a reference to health professional or some other more appropriate terminology would be helpful, and keep in context the different scenarios in which folks envision electronic health information exchange could be useful.
Also on safeguard number 10, what if it is not a query and response model?
So that I would duck back to the my comment before about the different bundling or packaging of conditions for trusted exchange. And so right now, as we've got them, there's a list. And so that is a great question in terms of if it isn't a query and response model, should we have a package that doesn't include a package of CTEs that an entity facilitating electronic health information exchange could be validated against that wouldn't necessarily need to be validated against this CTE. But if the entity was interested in facilitating both, kind of a push or query model, that they would be able to get a designation for both types of conditions for trusted exchange. That's some of the detail that we still need to work out. But a comment like that saying, there needs to be some distinction between CTEs that would be more appropriate for a single or particular method of exchange would be welcome feedback.
There's a comment that you had a bullet point in your objectives of governance slide that says relieve burden on states who are taking on disparate governance approaches. Could you comment about the RFI's position on the role of states in governance and ONC's position on the appropriateness of states participating and providing leadership related to governance on the Nationwide Health Information Network? That's a long one.
Yeah, sure, great question. Excuse me. States have a really important role. A key stakeholder in an electronic health information exchange nationwide in general. What we've seen through some research and feedback that we've received is that there are states have taken a wide range of approaches to trying to tackle governance in their jurisdiction. And what we hope this mechanism could do is to provide some consistency at the start for all the states. There are those that are pretty advanced. There are those that are just getting started. And if we can create a consistent set of conditions for trusted exchange on which all states could build, that would be an objective for this governance mechanism. Just to give you a little more detail on some of the state variation that we've seen, some have chosen to pursue governance, lowercase g, in a way of leveraging their procurement mechanism. So in different grants or contracts that they would seek to make available to the participants in their jurisdiction, they would include policies or other types of requirements similar to the conditions for trusted exchange that we've laid out in this RFI. Others have taken, in some cases, either a regulatory approach. Very few, as far as I'm aware, have gone so far as to implement legislative action, but we've seen other implement, I should say, and pass legislative action. We've seen other instances where states have floated legislative activity to take action and governance essentially related to electronic health information exchange. And that's really one of those things where we see ONC as the coordinating office being able to provide some real value here to help get everyone on the same page.
Is any attention being paid to potential patent issues?
Can you repeat that again?
Is there, as part of the RFI process or the work you guys have been doing on governance, has there been any attention paid to patent issues? I guess the idea of, is there intellectual property in this mix?
I wouldn't say that there has been a direct analysis of any type of patent application, but if the questioner or anyone else out there has any insight into things that we should be aware of, I would be, I guess I'm speaking on behalf of everyone here at ONC, I think we would be genuinely interested in what those would be, and where anything that we've discussed in the RFI may pose a conflict.
What is the potential cost to become an NVE, and maintain that accreditation?
That's a great question. And at the end of the RFI, we ask exactly those questions because we don't quite know, and there really there are some analogous-oriented accreditations. But I would be doing a disservice to everyone if I guessed the number. We do also ask a question, I believe, how long a validation should be, I guess, valid, for lack of a better word. The currency of the validation and how long it should last before it expires. So that would be another area where the cost may be offset over several years of recognition.
Stephen, when do you anticipate an NPR, a proposed rule coming out?
That is a great question, and I just can't speculate on a particular date at the moment. But we are, working on shaping it, and we're waiting on the feedback from this RFI to continue to inform our work.
What will the limitations be for HIEs who can't afford to participate in this new environment?
That's a really great question in terms of potential effects of those that go for that have the resources available to go for the NVE status, and those that don't. That would be something that we would need to consider, the effects of even the voluntary approach that we have laid out, and anything that we could do to accommodate those with that don't have the resources to go forward in the NBE process. I think if either the questioner or, again, anyone out there that has particular concerns or feedback that you could provide relative to the resources available to seek such a validation and the status, and obviously it's probably contingent on how much it would ultimately cost, that would be really helpful for us to understand as well. I guess I'll just take a quick pause because I know we're coming at the end of the questions here. I'd just like to say, I mean, I know you all have probably had 6 days to read through this. I think you can get a sense of how big it is, how open we need to keep our arms, to wrap our arms around this thing, just based on the questions that you all have tossed my way, and why it was really important for us to go out early and seek your feedback. Because without it, we'd be wrestling with these questions probably longer than would be helpful. So really good questions. Thanks.
Are you considering using a certification partner, sort of like what we did with EHRs and Meaningful Use, for certifying HIE vendors as NBEs?
I mean, I think that's in the realm of possibility. I mean, that would fall underneath our umbrella concept of validation. So where there are things that could lend themselves to a certification process, that could certainly be something that we would consider including as a way to demonstrate conformance with the conditions for trusted exchange.
Would an independent physician organization that exchanges information between its independent providers and hospitals need to become an NBE or follow the CTE?
Well, that's a great question. I mean, again, it would be voluntary, but I believe we noted in the RFI that type of organization could seek voluntarily the NBE status if it was interested in providing, showing to its, I'll say customers for lack of a better word, but the providers for which it facilitates electronic health information exchange. There you go, using the long answer, that they have met the conditions for trusted exchange in this federal baseline.
Analysis and reporting of de-identified data is being viewed by many HIEs as a possible value-add service for its participants. Is this precluded in the RFI or the proposed, where you're going with governance?
So that's a great question, and I would point you to Safeguard 6, which I believe discusses this concept in greater detail. And I think it's certainly an area where there is a lot of divergent policy views on what would be the best approach, recognizing that information has a market value, and it also raises different privacy and security concerns depending on the situations that are involved. So I would encourage you to read Safeguard 6 and comment on it, and if you're raising it from the extent of a potential business model that could be affected by the safeguard, that is certainly something that we want to hear about, and the potential effects that the policy represented in the safeguard could result in.
So we are actually out of time, and we do still have quite a few questions. So Stephen, I think we'll try to either do another program with you or take the remaining questions and work with you offline to try to get your answers, and we can post them subsequently. So maybe we should try to do both of those. But thank you, Stephen, so much for fantastic sharing of information, and what a great set of Q&A. So hopefully that'll help get at least many of these questions answered. And again, we're going to have to bring our program to a close. And we hope, or when you log out, by the way, a survey is going to pop up on your screen. So please do take a moment and complete the short survey. We do appreciate and need your feedback. And we hope that you'll join us next week for our programs on Wednesday and Thursday. So thanks, everyone, and have a great day.